We're getting closer to September 1st when user amounts of drugs will once again be illegal in Oregon. The end of Measure 110, the experiment which legalized drugs. Now, as part of the change, counties in the metro area are setting up something called deflection programs. They're an attempt to get drug users help and to keep them out of the jail system. An update on Multnomah County's plan and how things will look in Washington County. Those are our big stories tonight. Multnomah County's deflection plan got a big shakeup today, and we're going to hear from the county chair, Jessica Vega-Peterson, in just a few minutes. But we thought it would be useful for you at home and, maybe in Multnomah County as well, to learn how Washington County is going to handle deflection. Our guide will be the district attorney, Kevin Barton.
Maybe the starting point is that we've been meeting as a county since before the governor signed the new law. And I want to just emphasize that we've really leaned into this in a really significant way. I can't tell you the number of hours I've spent, hundreds of hours on this, because it's an important issue that we want to get right. It's also something brand new for Oregon.
So that's Kevin Barton. He says his county's deflection will sound similar to folks who have heard of diversion programs in the court system.
And for people to understand what deflection means, the best way of describing it is, I think people are generally familiar with a diversion program, like drunk driving diversion, something where we try and take someone out of the normal process and divert them toward treatment instead, and we give them a reward, which is the case might be dismissed or the charge might be decreased if they successfully complete that. Deflection is essentially the same idea, except it happens far earlier in the process. So before the court process starts, maybe even before the police officer brings someone to jail, out there on the street, the officer would present an opportunity for someone to divert or to deflect their case outside of the normal process.
Okay, so that's the plan. Keep a drug user's case out of the court system completely and help them get help to get off those drugs. Barton says Washington County is using approaches that have worked in other Oregon counties, along with techniques and programs that Washington County has used as well.
And proven approaches that have worked across the nation, drawing from things like specialty courts and treatment courts, or there's a program called Law Enforcement Assisted Diversion that originated out of Seattle and that Salem, Marion County, has done successfully. So we've taken bits and pieces from other programs that we know are evidence-based and have a high likelihood of success, and we've put them all into our Washington County deflection program. And starting on September 1st, that's when it will all begin.
Okay, so that's great high-level stuff. Now let's get specific. How will this work on the streets of Hillsborough or Beaverton?
Yeah, so scenario where, let's say, a Beaverton police officer is walking down the street and they see someone using fentanyl outside the Beaverton Public Library, which is a relatively common occurrence. That officer would have a reason to interact with that person, and if that officer develops probable cause that in fact is someone who's possessing or using fentanyl, that would be a crime called possession of a controlled substance. That's the new crime the legislature created. So that officer would have options available to him or her, and one of those options would be to issue a criminal citation. And that's different than what we currently have under ballot measure 110, but a criminal citation that commands that person to show up in court and to answer for a criminal charge of a possession of a controlled substance. Under our deflection program, for that Beaverton scenario, what that officer would also do would be to make a phone call to someone called a peer navigator or a peer support specialist. This would be a person who works for a community-based treatment organization, a place like LifeWorks Northwest or the Mental Health and Addiction Association of Oregon. And that would be someone who has lived experience. So they've been in that scenario, they know what it's like, and they can come out to the scene. And hopefully in the next 5, 10, maybe 15 minutes, that person actually arrives where the officer is there with that person. And the officer can do what we call a warm handoff. He can say to that person, look, you've been cited for this crime, but I want you to talk to Sally. Sally's been where you are. She can talk with you about some of your options, and we want to get you involved in treatment. And Sally would then take it from there. And the goal is that Sally would convince this person, hey, let's put you into this deflection program where if you successfully engage in treatment, and that's a key. In Washington County, we require everyone to successfully and meaningfully engage in treatment. But if you do, you can avoid criminal charges, you can avoid the prospect of jail time or a criminal record or things like that, and you can move forward with your life. And while we're at it, we can address any other issues you might be dealing with. Maybe there's housing instability, food insecurity. Maybe we can connect them up to other social welfare, things that might benefit them. But the goal is to leave them in a better position, to meet people where they are, but not leave them there, and help move them forward.
So there you go. The deflection program that the drug user will enter into, by the way, is going to last for 6 months. And Barton says people can only choose that route once a year. Also, there will not be a single place that people are dropped off, but the county is building 2 different locations that will be available in the near future.
There will be one central point, a hub that we rely on, and it's called our Center for Addiction Triage and Treatment, or CAT, C-A-T-T for short. That building was actually conceived in 2019. That idea was developed in 2019 before we had a fentanyl crisis and before ballot measure 110 was even passed by the voters. And that has been in process, and we just had a groundbreaking for it actually a month or 2 ago. So the timing of it is within the next year, we hope that new building and that new center will be ready to go. And it will be a 24/7 sobering and treatment center that will provide all sorts of resources for people that are involved in deflection. On day 1 of our deflection program, that building's not ready yet. So it's not quite ready yet, but there will be a center, and that will be a huge focus for us to center our resources around people and give them a place to go.
Okay, so there you go. That's how Washington County is going to handle drug deflection. What do you think about their plan? Let us know, will you? Send us an email. The address is thestory@kgw.com, or call and leave a voicemail. The phone number is 503-226-5090. It doesn't matter if you're watching live or later, we want to hear from you.